Hello, I'm Luke O'Neill and here I am in my lab as usual in the Trinity Biomedical Sciences Institute. So this week in my COVID-19 update, long COVID. Now we've discussed this before, it's one of the more malicious parts of this virus, I guess. You get long-term symptoms. The big question is how many people will get these symptoms, what are the risk factors? And a big study's just come out, over 4,000 people. And the main risk group are women who are 50 to 60 years of age. It's more prominent in that group, although it can happen in younger people as well. The second big determinant is if you've had symptoms for 5 weeks or more, that will predict the potential for long COVID. And the kinds of things we're talking about are brain fog, lack of concentration, fatigue, difficulty breathing, and of course if these persist for a number of months, people are very badly affected by this. The hope is we'll learn more about these risk factors and then maybe stop it happening. And another big question with COVID-19 is excess deaths. This is a really important number because it tells us how serious this disease is. What it means is how many people extra have died in this period than otherwise would die on average for that time of year, say. And the jury's out actually on the exact number, but the CDC in America have just published a big report. There were 300,000 excess deaths in America over the period of this year from COVID-19, and that's quite a big number. Now these are people dying of COVID, that's the key factor here. Some might die with COVID, which means they've got other diseases, and then COVID and sort of speeds up their demise, I guess. But this number actually is mainly people dying with COVID. One thing is it's mainly older people, of course, but there was a spike in July of people in their 20s and 30s actually dying at a higher rate of COVID, so it's quite a serious thing. And as time goes by, we'll get a much better picture of the total numbers of people dying of this disease. And a big study was done over the last 2 or 3 months on crowds attending a big event in Leipzig, of all places. And they assessed all these people, studied their risk of getting infected, mainly using modelling, it must be said. But there are some good results from this. First of all, the contact with people is quite limited. With the people you sit beside, I suppose, at the venue. It's that your bubble, if you will, and that's a good thing. But the second thing is you're inclined to meet a lot more people on the way in. And in fact, they model this and show the more entrances there are into a stadium, say, or a venue, the lower the risk it is of infection. So if we are going to get crowds back at, say, football matches, the greater number of entrances, the better, I guess, is the idea. A second thing was 90% of people were happy to wear masks at this big event, which is a good sign, I guess, because mask wearing at things like football matches or concerts may be the future. Another thing is if you want to buy food at a football match or a concert, go and buy the food and go back to your seat. Don't hang around eating it because there's a risk of you meeting more people, I guess, in that context. So again, there may be a way to bring crowds and crowds back to, say, a football match or indeed a concert following all these measures, and the risk of infection is then lessened. And you can hear about these stories and more on my weekly COVID-19 update on the Pat Kenny Show on News Talk this week.